So I think here at County Durham and Darlington NHS Foundation Trust we'll take fetal movements really seriously. It's really important that women call us and they're telling us if they're not happy with something. Essentially, if they're happy, we're happy. And we do talk a lot about fetal movements. I think in a community setting particularly, every time you have an appointment, your community midwife should be asking you, are you happy? Is this normal for you? Because it's such an important thing, and that's all to do with kicks count as well, isn't it? And our women can find information on that on our maternity webpage, also on BadgerNet when they access their leaflets or when they're received by the midwives as a push notification. I think one of the main problems is that people aren't sure what normal is for them.
Danielle, I would say for normal, so between 16 and 24 weeks we'd expect you to start to feel your baby's moving. So we'd expect them to start to feel a couple of little flutters. At first it might just feel like a nervous tummy, and then from then we'd expect baby to form a pattern of their own. Once little ones form their own pattern, we want mums to monitor that. So it might be for some women that babies are really active in the morning, less so at night. It depends, it's totally different for everyone. So keep a note of little one's pattern. Once baby changes from that, if baby reduces their movements, if they stop moving completely, or if they're really, really quick, then we want you to give us a call here at pregnancy assessment just so they can get checked out. It's so important. At home, we don't want any handhold Dopplers being used. It should always be by a midwife who's been trained or a health care professional who's been trained to do so. So it's so important that they call pregnancy assessment rather than just sitting at home and worrying about it. We don't mind, we're here 24/7. We'd much rather people ring than sit about it at home and worry.
That might involve a scan, it might involve us doing a little bit of closer monitoring, and if we don't know about it because that's been done in secret, then we can't act on it. So it is super important, always involve your professional.
Nothing's daft, we're here 24/7 and we're happy to answer any questions or any concerns, and we would love women to ring us when they get reduced movements for definite. Absolutely.